Portage Path Psychiatric Emergency Services, known by the acronym PES, is located on the top level of the Summit County ADM Crisis Center. Summit County residents can get the latest practices in psychiatric care to help manage psychiatric emergencies and return to a less restrictive environment as quickly as possible. 3 main services are provided to approximately 3,500 annually who find their way to PES: emergency evaluations, crisis stabilization, and probate assessments. Also housed at PES is a Summit County Support Hotline, a free, confidential crisis line answered by people trained to work callers through crisis and get the help they need. Over 9,000 calls per year are answered, including those made to the National Suicide Prevention Lifeline, which are routed to our hotline. PES is successful at helping clients in the community because of our strong clinical team and the interdependent partnerships that have formed during the 25 years Portage Path has operated PES under contract for the County of Summit ADM Board. We provide a lot of collaboration in the community. We work through Portage Path Behavioral Health and Psychiatric Emergency Services. We are on advisory boards for all mental health courts in Summit County. We provide services for crisis intervention training, and we are on the advisory board for that program. We're also on the advisory boards for the Hope Court as well as the New Day Court, which is Judge Bro and Judge Stormer. So we have a lot of collaboration with the criminal justice system. We also do educational trainings in the community. We go out and speak to the community on all the services provided with Portage Path as well as PES. We also, at Emergency Services, train NeoMed residents. They come into our facility and do their rotations at Emergency Services and work with Dr. Fayer and Dr. Akeem. We also do the training for the paramedic programs in Summit County, as well as we do the training for nursing students out of the university.
Here at PES, we provide psychiatric care 24/7. One of the highlights of working as a psychiatrist here at PES is the fact that I'm working as part of a great team of social worker, nurses, mental health technicians. We provide a psychiatric assessment, and based on the psychiatric assessment, we decide if the patients are safe to go home with a proper follow-up and resources, or the patient needs inpatient psychiatric hospitalization. 2 other options that we have available, and I think they are great for PES, are being able to keep the patients for an observation for 23 hours. We observe the patient and then we will reassess them and see how are they doing. Another option is for them to go to a crisis stabilization unit that we have available here in the building.
I'm attending on crisis stabilization unit for about 7 years. We are 16 bed voluntary residential unit. We receive patients from our emergency and step downs from local hospitals and North Coast Behavioral Health. As a team, we focus on crisis stabilization during each patient stay.
The hotline is a 24-hour-a-day hotline for anybody in crisis, and it started back in 1968 and has been available to the community ever since. We're also part of the National Suicide Prevention Lifeline Network, which you might be familiar with the number 1-800-273-TALK. That's a system that routes crisis calls locally, and we answer calls from Summit County residents to that line as well.
I've worked with Portage Path and with the Psychiatric Emergency Services for, a really long time now. We were there at the beginning when the building was set up and the decision was made to put Psychiatric Emergency Services on one side and alcohol and drug treatment on the other side. This may seem very logical. At the time it was considered truly revolutionary to have both of those things in the same place, which allowed for a drop-off center where perhaps family members or first responders, they didn't have to know which door to enter. They were going to get assistance with which door to enter. This became very important to both the criminal justice system and the civil justice system because it allowed people in crisis to be diverted from jail into a treatment facility regardless of whether the problem was mental health or drug and alcohol. But for people who were dealing with someone who was profoundly mentally ill, this was transformative. And it remains transformative, I think, for our county. Family members who have loved ones in crisis have access to trained professionals who can help them, not just by coming to psychiatric emergency services, but can take advantage of the fact that the wonderful staff is willing to go to them. This allows our families who have members who've been civilly committed or in the process of going through a civil commitment to work with a trusted and understanding professional person to get their family member the help that they need. I have to say that the services that we offer for our families who have people in crisis, we couldn't do it without psychiatric emergency services and Portage Path. It would be impossible to provide them with the immediate response that they need and deserve.
I believe that PES specifically is the pinnacle of the mental health services here in Summit County. Families, as they bring concerned clients into the building, they're impacted, some of them by mental illness for the first time, or some are really trying to get a handle on their loved one's mental illness. And I've just seen time and time again how they wrap around these families, these individuals, and really just form a bridge of support, patiently just explaining the process to them and what they might expect, and some are very appreciative of that. So I've seen that firsthand in my role for sitting in the lobby, performing those security duties. CIT, the green pin that I wear, is for the crisis intervention team. And I can tell you that it's probably impacted my life immensely from a standpoint of being able to provide services or point citizens, whether it be arrestees or not, in the right direction for services. So I'm very pleased and proud of my role, and I've always been willing to extend or lend a helping hand in any capacity that I'm able while inside the facility.
Having the luxury of having PES to be able to stabilize someone quickly and then get them back engaged in services that we provide is a tremendous asset to us in the probation department as well as the court. So I'm working with the mental health court and also with our CIT program. I've had the opportunity to talk with many communities throughout Ohio as well as the country. And the one thing that they all talk about that they wish they had is a place like PES, a freestanding crisis stabilization unit, that when someone's in crisis, law enforcement has a place to take them other than jail. The courts have an alternative other than jail to send someone to get the proper care that they need to be successful in the community. So we are very thankful to have a freestanding PES in our community.